Hey everybody, I'm here today to go over some technical terms for different anatomical movements, as well as going over some terms for general body positions. So first, we're going to look at flexion, extension, and lateral flexion. Flexion just means bringing two bones or two body parts closer together. For the knee, it looks like this, flexion. Extension is bringing two body parts or bones away from each other. Like this is extension at the knee. For the hip, flexion would be here. Extension would be going backward. At the waist, flexion and extension. At the shoulder, flexion is here, up to here. Extension is this way. The neck for flexion is this. For extension, it's tilting back. And the head can do lateral flexion to the left or to the right. Fingers, flexion, extension. Elbow joint, flexion, and extension. Next, we'll look at different types of rotation or circular movements. It's easiest to see with the arm that rotation is rotating about an axis. A similar motion is called circumduction, which is drawing a circle. With the leg, it can be rotation or circumduction. When the leg or the arm are bent, there is internal rotation and external rotation. For the knee, internal rotation and external rotation. For the arms, when they're down at your side, pronation is having your palms backward, while supination is having your palms forward. Next are two terms that describe movement of the limbs, either toward or away from the body. Abduction is to move away from the body, while adduction is to move toward the body. You can do that with your arm, abduction, adduction, or with the leg, abduction or adduction. Next are two motions that are generally just seen with the shoulders, elevation and depression. The neck, in addition to doing the lateral flexion and extension, there is protraction and retraction. The last few motions deal with the feet only. Those are inversion and eversion, as well as dorsiflexion and plantar flexion. Now we're just going to go over some terms that are used to describe relative places on the body, and they generally come in pairs. The first two are superior and inferior. They don't mean better or worse in this case, they only mean closer to the top of the head. So the heart is superior to the stomach. It doesn't mean that the heart is better than the stomach, you need both, but the heart is higher up compared to the stomach. Those are two relative positions. Next, anterior and posterior. Anterior means closer to the front, posterior means closer to the back. Something can be both anterior and posterior because those are relative terms. Your kidneys, which are here, are in front of or anterior to the spine, but they are posterior to the intestines. The next set would be medial and lateral. Medial means closer to the midline of the body. Lateral means further away from the midline of the body in either direction. Bilateral is a term that refers to structures that are the same on both sides of the body. Not all of them are. Ipsilateral and contralateral are terms trying to describe if two body parts are on the same side of the body or on opposite sides, respectively. Ipsilateral means that two body parts are on the same side of the body. Contralateral would mean that they are on separate sides of the body. Proximal and distal have to do with things on the limbs, where proximal means closer in proximity to the body, distal means distant or farther away from the body. Proximal and distal. And last, superficial versus deep. Superficial just means closer to the outside of the body, the skin. Deep means deeper into the body's cavities. So I hope that all was clear enough. We're going to practice these in class. To check your understanding today, I want you to abduct both arms, have complete flexion with the elbow joints, and then rapidly abduct and adduct the arms repeatedly. You can take a picture of yourself doing that. You can take a picture or get a picture of someone else doing that, or you can say what dance that is.